Let's continue our review of sleep and sleep medicine. We know sleep is important to restoring the energy of our body and mind and is vital for keeping us healthy. So let's explore normal sleep and discuss what issues can arise that cause people to have sleep problems. The National Sleep Foundation does surveys in the U.S. to gather information on the sleep of Americans, and the results give us a look into the sleep habits and the impact of sleep issues on our lives. These surveys have shown that 75% of adults report at least one sleep symptom, and 23% of sleep partners sleep in separate rooms. When disturbed by their partner's sleep, the other partner loses on average about 49 minutes of sleep per night. The survey also shows that 60% of adults drove while drowsy in the past year. Clearly, sleep and poor sleep is a big problem for people in the U.S. Now, we're all aware that our bodies function in rhythm, as in the rhythms of nature. Just like the rhythms of the sun and the moon, the tides of the ocean that ebb and flow, our bodies are intimately connected to nature. Sleep and wakefulness are part of the day-night cycle and are very important to that natural rhythm. Let's look at that rhythm to get a sense of how our system is connected. At 9 p.m., it becomes dark, and melatonin, which is a hormone secreted by the pineal gland at the base of the brain, helps to regulate other hormones and maintains the body's circadian rhythm. The circadian rhythm is the internal 24-hour clock that plays a critical role in when we fall asleep and when we wake up. When it is dark, your body produces more melatonin, and that moves us from wakefulness into sleep. At 10:30 p.m., bowel movements are suppressed. And at 2 a.m., we reach our deepest sleep. At 4:30 a.m., we reach our lowest body temperature. And at 6:45 in the morning, when we go from sleep to wakefulness, we have our sharpest rise in blood pressure. At 7:30 in the morning, melatonin secretion stops as daylight becomes more noticeable and signals our brain to stop producing it. Bowel movements are likely around 8:30 in the morning. We reach our highest alertness during the day at about 10 a.m. At 2:30 p.m., we have our best coordination, and at 3:30, our fastest reaction time. About 5 p.m. is our greatest cardiovascular efficiency and muscle strength. At 6:30 in the evening is our highest blood pressure, which is interesting in that it coincides with our rush hour traffic and driving home. At 7 p.m. is our highest body temperature, and that is the rhythm that our body is in throughout the day. If, as many of us do, we condense our sleep time, for example, we go to bed about midnight and wake up about 5 a.m., we shift this natural rhythm, and that rhythm is then out of balance, and it can lead to what we may call dis-ease in our system. So maintaining this natural rhythm by being respectful of our body's need for sleep and rest is vital to maintaining our health. Related to our sleep-wake cycle, the question is often asked, well, what is the amount of sleep that will keep us the healthiest? There was a study done at the University of California at San Diego in 2002 by Kripke and others, where they assessed 1.1 million people and found that the participants who reported sleeping more than 8 hours or less than 6 hours during the night experienced significantly increased mortality rates. In other words, their survival or their length of life was reduced by about 15%. In addition, they had about 15% higher rate of health problems. So the best survival was found among those people who slept about 7 to 8 hours per night. So let's explore sleep and sort of give you an overview of sleep medicine. If we look at the sleep cycle and the characteristics of the sleep cycle, there are two distinct states of sleep. There's non-REM, which are stages N1, N2, and N3, And then there's REM, or rapid eye movement sleep. Normally, we go through about 4 to 5 cycles of sleep per night, and that is the natural rhythm of our sleep. So let's take a look at these sleep cycles. N1 sleep is a transition period from wakefulness to sleep. It's like a dozing stage, and about 5% of the night is spent in N1 sleep. Now, if somebody walked in the room while you were in N1 sleep, you would know they were there, and they could just talk to you in a normal voice in order to wake you. N2 sleep is a light to moderate phase, and about 50% of the night is spent in N2 sleep. Now, if somebody wanted to wake you, they would come into your room and they would need to speak to you in a loud voice in order to wake you if you were in N2 sleep. Some of my neurologist colleagues call N2 sleep the gateway, because through N2 sleep we move into REM, and through N2 sleep movements or activity occurs, even bruxism. So this is a gateway from deeper sleep into lighter sleep or REM sleep. That's N2. Stage N3 sleep is characterized on a sleep study by deep sleep or slow waves in the polysomnogram or sleep study. Deep sleep is a phase where if somebody wanted to wake you, they would have to walk into your room and actually shake you and speak in a loud voice to wake you up. And if they were able to wake you, you would feel groggy and disoriented. About 20% of the night is spent in stage N3 sleep. And during N3, growth hormone is secreted. So for a very small percentage of children, if their sleep is disrupted during the night and they're not getting into N3 sleep, it could influence their growth. So this should be part of the differential diagnosis in kids who are not growing normally. REM sleep is rapid eye movement sleep. Most dream periods occur during REM sleep. About 25% of the night is spent in REM, and during REM sleep, the skeletal muscles are completely paralyzed. So there are really only 2 muscles that function outside of the heart. One are the eye muscles, and the second is the diaphragm. The first REM period occurs about 60 to 90 minutes into sleep, and then the REM periods occur in the second half of the night much more frequently, and they last longer. REM sleep is a vital part of our restorative sleep cycle. When our sleep is disrupted, it also reduces the amount of REM sleep that people will experience during the night. There are many different types of problems that can arise that are associated with sleep, as we well know. For example, insomnia is a disorder that's characterized by difficulty falling asleep or staying asleep, and it affects about 30% of the population. Narcolepsy is a chronic disorder of the central nervous system characterized by the brain's inability to control our sleep-wake cycles. And at various times throughout the day, people with narcolepsy will experience an irresistible or a sudden bout of sleep. They call them sleep attacks, and these can last from a few seconds to 30 minutes. Now, a small percentage of people will suffer from narcolepsy, but it can be profoundly difficult on them to maintain their wakefulness and be alert during the day. Restless leg syndrome and periodic limb movement disorder are also difficult issues. Now, restless leg syndrome is a sensory motor disorder characterized by these periodic irresistible urges to move the legs or arms, usually the legs. And it's usually associated with an unpleasant or uncomfortable sensation in the legs. These symptoms occur during wakefulness, but about 80% of the people with restless leg syndrome also have periodic limb movement disorder during sleep, in which they involuntarily will move their arms and legs while they are sleeping. REM behavior disorder is more common in people older than 50 years of age, but the disorder may begin at any age. The overwhelming majority of people with this disorder are older men. Now, this disorder most frequently presents with the complaint of dramatic or even violent activity during sleep. These disorders include talking, yelling, grabbing, punching, kicking, even falling or running out of bed. People with REM movement or REM behavior disorder have a high probability of developing Parkinson's later in life. Obstructive sleep apnea is the disorder that we're going to focus on today, but I think it's important to understand that there are many different types of sleep problems that can affect people. And these problems come at a great cost to the patient and to the public. About 20% of all motor vehicle accidents are sleep-related. Sleep disorders lead to about $16 billion annual direct costs per year to Americans, and about $50 to $100 billion of indirect costs related to accidents, litigation, property damage, hospitalization, or even death. So sleep disorders have a tremendous impact on the world around us and come at great cost. So let's look at snoring and sleep apnea more closely. What we know is that about 2/3 of adults snore. This means that 2/3 of the adults in your practices are snorers, and it's incumbent on us as dentists to start to identify these people and get them on a path to getting healthier. If you look at the prevalence of snoring and sleep apnea in the U.S., there was a study done at the University of Wisconsin in 1993. It showed that about 9% of men and 4% of women have signs of apnea on testing, and 4% of men and 2% of women have signs and symptoms of apnea. This same group at the University of Wisconsin that completed the study in 1993 followed up with estimates in 2005, which showed that they now believed that somewhere between 17 and 20% of adults have apnea based on prevalence of obesity in the U.S. Sleep apnea is more prevalent than diabetes or asthma, and it is having a tremendous impact on people's health and their quality of life. But that's really just the tip of the iceberg, because only 15% of those patients have been diagnosed. And again, as dentists, where we see patients every 6 to 12 months, it is really our responsibility to start to screen patients and identify them. If you look at the healthcare resources and utilization of healthcare for people with sleep apnea, there was a study done by Krieger as far back as 1997 where he showed that sleep apnea patients use healthcare resources at approximately twice the rate of controls as far back as 10 years before they're diagnosed. So these are people that are going to see the physician for heart problems, diabetes, asthma, chronic health conditions. And these patients also have sleep apnea that is making their health condition worse. And they don't get diagnosed for about 10 years. And they've been seeing the doctor for this period of time. It's been aggravating the problem, and they are having much less success in managing the health problem. And once they are diagnosed, it starts to shift their health and help them manage the problem. But you talk about healthcare reform, if we're able to diagnose these people and get them on a path to being healthier, it'll save billions of dollars in healthcare costs. So let's now look at how sleep apnea can impact our physiology, because sleep apnea has a tremendous impact on how our body functions. During apnea, we stop breathing, which causes oxygen levels to drop. Carbon dioxide levels increase in the blood. Acidosis can occur, and there are cardiovascular consequences to this, in addition to the sleep fragmentation, which is leading to daytime sleepiness. As you know, when our breathing stops partially or completely, there's a response by the autonomic nervous system. The autonomic nervous system, as we know, is made up of the sympathetic nervous system, which is the fight or flight portion, and the parasympathetic nervous system, which is the rest and restore portion. When our breathing stops, as it does in an apnea event, the sympathetic nervous system takes over to protect us, and it produces adrenaline. This adrenaline response leads to an increase in blood pressure, an increase in heart rate, a decrease in cardiac output, and at the same time oxygen levels are dropping. So it puts a tremendous amount of stress on our system, and it leads to significant physiologic consequences. For example, in patients with sleep apnea, there is an incidence of about 60% hypertension. In other words, of all sleep apnea patients, we see a 60% probability that they will have hypertension, an 8% probability that they'll have a heart attack, and 7% probability that they'll have a stroke. This is significantly higher than the general population. And if we look at patients with cardiovascular disease, 90% of people with nocturnal angina have sleep apnea. 76% of patients with coronary artery disease have sleep apnea. 38% who have heart attack have sleep apnea. So there is a very strong correlation between cardiovascular disease and sleep apnea. A case in point is Reggie White, who was a Hall of Fame defensive lineman for the Philadelphia Eagles and Green Bay Packers. Reggie had severe obstructive sleep apnea and he couldn't tolerate CPAP. And in December of 2004, he died in his sleep. And his wife said that he died of sleep apnea. Now, the cause of death was probably cardiovascular related, heart attack, but she was clear that because he couldn't tolerate CPAP and she would hear him stop breathing with long pauses during the night, she was convinced that the apnea was the cause of his death. And she also said that if they had known that oral appliances were available, that it could have saved his life. As you might guess, obstructive sleep apnea is a significant health problem for many football players. Let's talk further about the effect of sleep apnea on our health and lives, and let me give you 5 major areas where we see tremendous impact on health and on our quality of life. There's a significantly greater risk of motor vehicle accidents in people with sleep apnea, 3 times greater risk than the general population, and a 7 times greater risk of multiple accidents. There's a much higher rate of loss of employment in people with sleep apnea who are struggling to maintain their alertness on the job. People with sleep apnea also have difficulty changing their health or disability insurance, and they become rated once they are diagnosed. Hypertension is connected with sleep apnea, as I mentioned previously. But the number one reason that people come into my office is that their wife has left the bedroom, or their hunting and fishing buddies have said, "You're not invited anymore on the fishing or hunting trips." So those are 5 areas where it really impacts people's health and their lives. But sleep apnea can also have a significant impact on length of life or survival rates. In a study that was done in 1988 in Canada that's been supported by a number of more recent studies, they showed that patients who had an apnea index greater than 20 events an hour and did not use their CPAP machine reduced their life expectancy by about 5 to 7 years. Now, this is important data because when we consult with patients, we need to be able to deliver this information to help them understand the importance of pursuing treatment. So what are the factors that predispose us to obstructive sleep apnea? Well, age is certainly a factor, and as we get older, there's a higher prevalence of obstructive sleep apnea. Obesity is also directly connected to sleep apnea in that increasing weight will lead to, or is connected to, increasing apnea severity. Gender also predisposes us in that men are 4 times more likely to have sleep apnea than women. However, postmenopausal women have a prevalence of obstructive sleep apnea the same as men of the same age. Disproportionate airway anatomy, large tonsils, long soft palate, large tongue can also predispose people to apnea and is especially impactful in children. Alcohol and sedative hypnotics in the evening can have a direct effect on apnea severity and snoring. In other words, having alcohol at night can turn a non-snorer into a snorer, an apneic into a severe apneic. And so it has a direct effect on the muscles that line the airway. Hypothyroidism is also connected in that the symptoms of hypothyroidism are similar to those of apnea, and there's a relatively high incidence of sleep apnea in patients with hypothyroidism. So thus far we've been talking about the problems for the patient with sleep apnea or snoring. What about the effect on the sleep partner? Well, there was a study done at the Mayo Clinic in 1999 where they looked at 10 married couples and they brought them into the sleep center and they did a split night sleep study. In other words, half the night was diagnostic and the second half of the night was used for treatment with CPAP. and they had the spouse sleep in the bed next to the patient who had snoring or sleep apnea. And what they found in the study is that the patient had an apnea-hypopnea index of 26 events an hour that was reduced in the second half of the night with CPAP down to 7. The spouse who was sleeping next to them had 21 arousals during the first half of the night. And when the patient was treated with CPAP, that arousal index went down to 12 an hour. This is equivalent to an increase in sleep of about 1 hour per night when the snorer and apneic is treated. And what they noted is that spouses who slept next to snorers and apneics had increased pain complaints and reduced quality of life. But once the problem was treated, this significantly improved their quality of life and their health. So it's amazing to see the impact, not just on the person with snoring and apnea, but on the sleep partner as well. So what have we learned through this discussion this morning about sleep and sleep problems? Well, we know that restful sleep is crucial to maintaining our vitality and health, and that snoring and sleep apnea have a high prevalence, have significant health consequences, and are largely undiagnosed. Sleep apnea can impact a patient's quality of life and shorten their life expectancy. Snoring and sleep apnea can have an effect on the health of the sleep partner as well. And dentists can play an important role in identifying patients with snoring and sleep apnea and guide them along the path to better health.